Hello and welcome. Today I'm going to talk about another viral infection named Erythema Infectiosum. Erythema Infectiosum is also referred to as fifth disease, and it is also called slapped cheek syndrome. It is caused by the smallest DNA virus named parvovirus B19. It is primarily transmitted through respiratory droplets. However, it is also transmitted via an infected blood transfusion. A pregnant female can also transmit the virus through the placenta to her unborn child. Now, the clinical features of parvovirus B19 infection. First is prodromal illness, which comprises of low-grade fever and coryza, which is runny nose. Second is exanthem, which comprises of slapped cheeks rash, which is intensely red rash on the face, followed by reticular rash on extremities and trunk. Reticular meaning net-like or web-like. Third is polyarthritis. It is more common in adults and causes arthralgia, which means joint pain. This polyarthritis is usually resolved after 7 to 10 days. Now, pathophysiology of the parvovirus B19 infection. The parvovirus B19 infection first enters the cells of the respiratory tract and then into the circulatory system until it reaches the bone marrow, where it causes apoptosis or cell death, as a result of which less new RBCs are produced. Complications of parvovirus B19 infection. Number 1. Transient aplastic crisis, which is the temporary cessation of erythropoiesis. That means temporary failure of RBC's production. This transient aplastic crisis occurs in those individuals who have underlying conditions such as sickle cell anemia, hydroerythrocytosis, and thalassemia. Number 2. Hydrops fetalis, which is the abnormal accumulation of fluid in soft tissues of the fetus. You can see the illustration below. Now, the pathophysiology of these two complications. Patients with sickle cell anemia, hydroerythrocytosis, and thalassemia already have fewer RBCs, and because they already have less RBCs, the breakdown of erythropoiesis due to parvovirus B19 results in severe anemia, which leads to a aplastic crisis. Parvovirus B19 in a pregnant female can cause anemia in her fetus, and because there are less red blood cells to carry oxygen, the heart will pump a larger volume of blood to the fetus to give the fetus all the oxygen it needs. This raises pressure inside blood vessels, and fluid starts to leak out of the capillaries, and this leads to hydrops fetalis. Now, the diagnosis of parvovirus B19 infection. Parvovirus B19 infection is usually diagnosed by clinical examination. Look for slapped cheek appearance or reticular appearance of rash. However, it can also be diagnosed by lab tests. First method is enzyme immunoassay, which is also called ELISA test, and it looks for IgM and IgG antibodies against parvovirus B19. Another option is polymerase chain reaction (PCR), which looks for viral DNA. It is the preferred diagnostic method of parvovirus B19 infection in immunocompromised patients who typically do not have high IgM and IgG levels in response to an infection. Let's talk about the treatment of parvovirus B19 infection. Treatment is not necessary in most cases. as the disease is often self-limited, so only supportive treatment is given. While the patients with transient aplastic crisis often requires blood transfusion, patients with arthralgia or arthritis are treated with NSAIDs. Fetal blood transfusion is required if hydrops fetalis is detected. Lastly, there is no vaccine available for parvovirus B19 infection.